excited to be here and talk to you a little bit about ergonomics, working from home. We do see folks who have chronic low back and neck issues or pains, and they have to be working from home. They're on their computers and not in ideal working situations. So the first thing I kind of wanted to talk about is ergonomics, or the way we should sit is based on our biomechanics, our spine. So how to reduce the amount of strain on our spine. One rule of thumb is if you can bring your computer up to eye level. So you want the top of your screen to be eye level when you're sitting upright. So that way, when you look at the screen, the top of the screen is eye level. When you look at the screen, you're slightly tucked, meaning your chin is down just a little bit, slightly. That's really an ideal head position for you. Also in your chair, hopefully have a little bit of lumbar support in it so you're not slouching in it, and your chair should be raised up to a point where your hip is above your knees. So if you're sitting on a couch and it's a deep couch, your knees will be sitting above your hips. That's not ideal for your low back and especially your sacrum at risk. So if you're sitting in a chair where your hips are slightly above the knees, that'll be ideal. And keeping your feet level to the ground, it will be the ideal ergonomics. Further, if you have an armrest that can support you, if you're using a mouse, that the arm is resting to your side at 90 degrees, so you're not reaching out further ahead and you're not further back as well. So you're ideally just kind of in a neutral position so that your elbow is just right there at your side with your mouse in hand. So you don't have to be further reached forward. So there are tons of literature out there you can read on ergonomics. I just wanted to hit on those particular points. Those are important to think about. More than trying to attain this perfect ergonomic posture as we sit, and I think that's been the focus, we should really be trying to think about moving more often throughout our day. So in other words, philosophically, I believe trying to reach this perfect ergonomic state all day long is just not possible. We're going to naturally succumb to gravity. We're going to naturally want to lean and slouch on our joints because it takes muscle activation to hold ourselves up perfectly. And if you're on the computer for hours on end, that is just going to wear you out. What I really recommend is taking movement breaks, hourly. One of the things that we preach here is movement is medicine. If you move frequently, your joints will feel much better. Ideally, your body won't ache as much, especially for our chronic pain patients. Their go-to immediate thought is, I'm in pain, I'm going to lie down. Movement is medicine. Try to go for a walk or get up out of your chair and change your behaviors around that. Same thing for you all who are working from home. Frequent rest breaks and movement is medicine rather than trying to attain this perfect ergonomic posture. And even if you were to do the perfect posture for an hour, you're still going to have some pain because repetitive stress to those muscles. So even with perfect posture, you're going to feel soreness in the upper traps, in the base of your skull, along your shoulder blades as well. If you would do this with me, take your hand and just reach the opposite shoulder and try to grab this muscle right above your shoulder blade. It's called the upper trapezius. And if you kind of grab that, you'll find that it might be tender if you squeeze on it. So go ahead and just kind of find a tender spot. And if you press on it and it travels to your head, meaning there's some kind of sensation that travels to the head or down the shoulder blade or even to the arm, you have what's called a trigger point. And those are very common in people who sit all day. And these muscular trigger points, and the common ones are in the upper trapezius muscle and the levator muscle. These muscles are in a chronic state of contraction. The muscle is contracted, and that's why it feels like a tight band or even maybe a knot. And that's what we call myofascial trigger points or just trigger points. And the telltale sign of a trigger point is if you squeeze on it, it radiates. It actually travels a little bit. It might go to the front of the shoulder. And those are issues, right? We want to make sure that we try to work them out. Self-massage is great. Massage guns are great. Stretching is another one we do here quite a bit. And part of my practice, what I do is we use something called dry needling, where we use an acupuncture filament and we try to break the muscle up directly. It's very quick and safe, and we can break up trigger points very effectively that way. Please let me know if I can be of other assistance.